This is All India Radio. We now bring you a special news program on COVID-19. Good evening. I am VC Pramod and with me is Vaibhav Srivastav. The headlines. Prime Minister Narendra Modi says India's fight against COVID-19 is people-driven. In his Mann Ki Baat, Prime Minister says centre and state governments working hand in hand to provide relief to the needy. Mr. Modi urges people to follow Ayush Ministry's corona-related protocol to boost immunity. RSS Chief Mohan Bhagwat appeals to Swayamsevaks to work proactively and help all those affected due to COVID-19 pandemic. Standalone and neighborhood shops open in non-hotspot zones in many states. Over 684 tons of essentials and medical supplies delivered by Lifeline Udan during lockdown. India hands over emergency medical supplies including hydroxychloroquine tablets and sterile surgical gloves to Bangladesh. Prime Minister Narendra Modi has said that India's fight against corona is people-driven and along with the people, the government and the administration are fighting the pandemic. Sharing his thoughts in Mann Ki Baat program of All India Radio today, Mr. Modi said, each and every citizen of the country is a soldier in this battle and they are leading the battle. He lauded the resolve of the people as to how at each and every place people have come forward to help each other.
भारत जैसा विशाल देश जो विकास के लिए प्रयत्नशील है, गरीबी से निर्णायक लड़ाई लड़ रहा है, उसके पास कोरोना से लड़ने और जीतने का यही एक तरीका है और हम भाग्यशाली हैं कि आज पूरा देश का हर नागरिक जन जन इस लड़ाई का सिपाही है, लड़ाई का नेतृत्व कर रहा है। आप कहीं भी नजर डालिए, आपको एहसास हो जाएगा कि भारत की लड़ाई पीपल ड्रिवन है।
The Prime Minister said, from arranging food for the needy to supply of rations, compliance of lockdown, from arrangements in hospitals to manufacturing medical equipment indigenously, the entire nation is marching ahead together. Mr. Modi urged people not to get caught in the trap of overconfidence and not harbor a feeling that if corona has not yet reached their city, village, street or office, it is not going to reach them now. Mr. Modi said, "Do gaz duri hai zaruri" should be our mantra and people should maintain a distance of 2 yards and keep themselves healthy. Mr. Modi said, in the changed paradigm due to corona, masks are becoming a part of the lives of people. Mr. Modi said, another awareness that has come about in the society is that people now understand the damage that can be caused by spitting in public places. He said it had been a part of the bad habits that people would spit anywhere and it presents a serious challenge both to cleanliness and to health. He said people must eradicate the spitting habit. The Prime Minister said the resolve the countrymen displayed during the crisis has led to the beginning of a new transformation in India.
हर मुश्किल हालात, हर लड़ाई कुछ न कुछ सबक देती है, कुछ न कुछ सिखा करके जाती है, सीख देती है, कुछ संभावनाओं के मार्ग बनाती है और कुछ नई मंजिलों की दिशा भी देती है। इस परिस्थिति में आप सब देशवासियों ने जो संकल्प शक्ति दिखाई है, उससे भारत में एक नए बदलाव की शुरुआत भी हुई है। हमारे बिजनेस, हमारे दफ्तर, हमारे शिक्षण संस्थान, हमारा मेडिकल सेक्टर, हर कोई तेजी से नए तकनीकी बदलावों की तरफ भी बढ़ रहे हैं।
The Prime Minister said the centre, state governments, each and every department and institution are working hand in hand for relief at full speed. People working in the aviation sector, railway employees are working day and night to alleviate hurdles confronting the countrymen. Underlining the government's commitment to help the needy and the poor, the Prime Minister said money is being directly transferred to the accounts of the poor as part of the Pradhan Mantri Garib Kalyan package.
प्रधानमंत्री गरीब कल्याण पैकेज के तहत गरीबों के अकाउंट में पैसे सीधे ट्रांसफर किए जा रहे हैं। वृद्धावस्था पेंशन जारी की गई है। गरीबों को 3 महीने के मुफ्त गैस सिलेंडर, राशन जैसी सुविधाएं भी दी जा रही हैं। इन सब कामों में सरकार के अलग अलग विभागों के लोग, बैंकिंग सेक्टर के लोग एक टीम की तरह दिन रात काम कर रहे हैं।
Expressing his deepest regards for the medical service personnel across the country, Mr. Modi said the doctors, nurses, paramedical staff, community health workers and all such personnel who are working round the clock to ensure a corona-free India. He said we need to ensure their safety, and the ordinance that has been issued recently is a step in this direction. The Prime Minister said doctors, cleaning staff and other such services personnel and even the police organizations are being seen in a new light by the common people. He said today the police personnel are ensuring that food and medicines reach the poor and the needy. He added that it is a time when common folks are connecting with the police at an emotional level. Mr. Modi said that the government has come up with a digital platform, covidwarriors.gov.in. The volunteers of social organizations, representatives of civil society and local administration have been linked with each other through this platform. The Prime Minister highlighted that during the crisis, India provided medical supplies to the needy across the world in line with its humanitarian responsibility. He said people across the world are paying special attention to the importance of India's Ayurveda and yoga and its role in boosting immunity. Mr. Modi urged people to follow the corona-related protocol to boost immunity by the Ministry of Ayush. The Prime Minister said the holy month of Ramadan has begun and people should pray more than ever before so that before Eid the world is free from corona and people can celebrate Eid with enthusiasm. Reacting to Man Ki Baat, Union Minister Prakash Javadekar highlighted the importance of discipline in the fight against coronavirus.
अनुशासन का अनुभव करेंगे और अनुशासन का पालन करेंगे, 2 गज दूरी बनाए रखेंगे, मास्क पहनेंगे और घर में ज्यादा से ज्यादा रहेंगे तो इसका परिणाम हम कोरोना को हराएंगे। और ये उन्होंने विश्वास व्यक्त किया कि 1 महीने के अंदर इसको हराना है। इसलिए रमजान का उल्लेख करते हुए उन्होंने कहा कि ईद आते आते तक हम इसको हराएंगे।
Prime Minister Narendra Modi will interact with chief ministers via video conference tomorrow morning. Discussion is on the way ahead in the fight against the novel coronavirus, slated to be on the top of the agenda in the conference. This will be the 3rd video conference of the Prime Minister with the chief ministers after the announcement of nationwide lockdown since last month. More from our correspondent.
Prime Minister Modi announced the first lockdown last month after considering viewpoints of all the chief ministers. Even the announcement of its extension till 3rd May included views from across the states. With just a week remaining for the extended lockdown to end, the 3rd meeting of Prime Minister Modi with the chief ministers is considered to be crucial in many aspects. Telangana has already announced lockdown till 7th of next month, whereas other states are monitoring daily updates to decide the future course. Government has earned laurels from across the world in its handling of novel coronavirus, and through a series of decisions it has ensured normalcy and availability of essentials. Prime Minister in his Man Ki Baat as well said that he would hope that the coming Eid brings eradication of this corona menace. Anand Chaturvedi, AIR News, Delhi.
Health Minister Dr. Harshvardhan has said that the mortality rate of COVID patients in India is 3.1% compared to 7% at the global level. He said 5,913 people have been cured till date, resulting in recovery rate of around 22%, which is also better than most of the countries. The minister today visited AIIMS Trauma Center and took stock of their preparedness to overcome the COVID-19 pandemic. Jayaprakash Narayan Apex Trauma Center of AIIMS is functioning as a dedicated COVID-19 hospital consisting of 250-bed isolation ward. He interacted with few COVID-19 affected patients and inquired about their well-being. The number of COVID-19 cases in the country has climbed to 26,917, while the death toll rose to 826. The Health Ministry data said the number of active COVID-19 cases stood at 20,117. As many as 5,913 people have been cured or discharged and 1 had migrated. Health Ministry data said Maharashtra was the highest number of cases with 7,628, followed by Gujarat with 3,071 and Delhi with 2,625 cases. The highest number of people who have lost their lives are in Maharashtra, that is at 323. Gujarat has reported 133 deaths, Madhya Pradesh 99 and Delhi has reported 54 deaths. National Thermal Power Corporation Limited, NTPC, has invited Global Expression of Interest, EOI, to provide 10 hydrogen fuel cell FC-based electric buses and an equal number of hydrogen fuel cell-based electric cars in Leh and Delhi. The EOI has been issued by NTPC's wholly owned subsidiary, NTPC Vidyut Vyapar Nigam Limited. The move to procure hydrogen fuel cell-based vehicles is a first-of-its-kind project in the country, wherein a complete solution from green energy to the fuel cell vehicle will be developed. The production capacity of coveralls required by medical personnel treating COVID-19 cases in the country has been ramped up to more than 1 lakh per day. Bengaluru has become a major hub for PPE coverall production in the country to combat COVID-19 cases. Nearly 50% of the coverall production in the country is from Bengaluru. PPE coveralls are also being manufactured by approved production units in Tirupur, Chennai and Coimbatore in Tamil Nadu, Ahmedabad and Vadodara in Gujarat, Phagwara and Ludhiana in Punjab, Kolkata, Delhi, Noida, Gurugram and a few other places. The Health Ministry issued a detailed guideline for bringing back human remains of confirmed or suspected COVID-19 patients in the country. However, the ministry asserted that importation of human remains of such cases is not recommended. In cases where human remains of suspected or confirmed COVID patients arrive in the country, validation of cause of death, no objection certificate from the Indian mission, and embalming certificate has to be produced as a required precautionary step. More from our correspondent.
The guidelines say that the airline and airport health officer will ensure that all preventive measures related to importation are followed. The personnel handling the human remains should follow the laid-down procedure for doing and doffing of personal protective equipment and follow other protective measures for COVID-19. All the norms for burial of human remains with high-risk pathogens are to be followed. Quarantine of 28 days for the staff handling such importations has also been recommended. Any death on board during the pandemic will be considered as a suspected case of COVID-19 and should be attended following recommended standard procedures. Strict adherence of guidelines must be followed at burial grounds and crematoriums. Divakar, AR News, Delhi.
Indian Railways Production Unit Rail Coach Factory RCF at Kapurthala has reopened its production process after 28 days nationwide lockdown. In a relentless battle against COVID-19, the factory has been opened adhering all safety precautions and guidelines, and despite limited availability of resources for production, it has produced 2 parcel coaches, 1 LHB high-capacity parcel van and 1 luggage-cum-generator car in the last 2 days. A total of 3,744 employees have been permitted to join the work who are residing inside RCF premises township. In an effort to guard against fake news being circulated on various platforms, we bring you our segment on fact-checking and mythbusters. The government has rejected a claim of a web news portal that the centre is likely to reduce retirement age of government employees to 50 in the coronavirus crisis. Press Information Bureau said the claim made within the report is false. It said centre is neither planning nor discussing any such move. Government today dismissed a claim doing the rounds on WhatsApp that it is going to bring in an act to have 18% income deposited by all taxpayers. In a tweet, Press Information Bureau clarified that no such move is being discussed by the government. It said this is a figment of imagination aimed at scaremongering.
This is All India Radio bringing you a special program on COVID-19. A reminder of the headlines before we move on. Prime Minister Narendra Modi says the India's fight against COVID-19 is people-driven. In his Mann Ki Baat, Prime Minister says centre and state governments working hand in hand to provide relief to the needy. Mr. Modi urges people to follow Ayush Ministry's corona-related protocol to boost immunity. RSS Chief Mohan Bhagwat appeals to Swayam Sevaks to work proactively and help all those affected due to the COVID-19 pandemic. Standalone and neighbourhood shops open in non-hotspot zones in many states. Over 684 tons of essentials and medical supplies delivered by Lifeline Udan during the lockdown, and India hands over emergency medical supplies including hydroxychloroquine tablets and sterile surgical gloves to Bangladesh. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
Krishna दर्शकों का पसंदीदा धारावाहिक श्री कृष्ण जल्द आ रहा है डीडी नेशनल, फ्री डिश और अन्य डीटीएच चैनल पर। सब्सक्राइबर्स अपना चैनल नंबर नोट करें। फ्री डिश 001, टाटा स्काई 114, एयरटेल 148, सन डायरेक्ट 302, वीडियोकॉन D2H 149, डिश टीवी 193 और डेन 138। आगामी आकर्षण धारावाहिक श्री कृष्ण। लोकप्रिय धारावाहिक महाभारत प्रतिदिन दोपहर 12 बजे और शाम 7 बजे डीडी भारती, फ्री डिश और अन्य डीटीएच चैनल पर। सब्सक्राइबर्स अपना चैनल नंबर नोट करें। DD 60, टाटा स्काई 1194, एयरटेल 151, सन डायरेक्ट 326, वीडियोकॉन DTH 480, डिश टीवी 197 और डेन 522। समय याद रखें, दोपहर 12 बजे और शाम 7 बजे। प्रतिदिन देखें लोकप्रिय धारावाहिक महाभारत।
अथ श्री महाभारत कथा।
Rashtriya Swayamsevak Sangh RSS Chief Dr. Mohan Bhagwat has appealed to Swayamsevaks to work proactively and help all those affected due to COVID-19 pandemic. He also urged them to work for the betterment of the country by maintaining positive attitude in this situation and staying away from fear and anger. Mr. Bhagwat was addressing an intellectual session, Bodhik, of the RSS Swayamsevak Sangh, conducted through video conferencing from Nagpur Mahanagar branch today. He appealed to Swayamsevaks to continue relief work till COVID-19 pandemic ends.
जो इसके पीड़ित है वो हमारे अपने हैं। भारत ने तो जिन दवाइयों के निर्यात पर बंदी लगाई थी, दुनिया के हित के लिए उसको हटाकर थोड़ा बहुत अपने तरफ नुकसान लेकर भी दवाइयां भेजी है, क्योंकि ये हमारा स्वभाव है। हम मनुष्यों में भेद नहीं करते और ऐसे प्रसंगों में तो बिल्कुल नहीं। सब अपने हैं। जिसकी जिसकी आवश्यकता है उन सबकी सेवा, जितनी अपनी शक्ति है उतनी सेवा करनी।
Shops are beginning to open in rural and urban areas of the country following Centre's order permitting registered neighborhood and standalone shops to open amid the coronavirus lockdown. The Home Ministry order, which came late Friday night, came as a reprieve to public at large. However, market complexes within the limits of municipal corporations and municipalities are closed. A report.
Standalone shops, including those selling garments, mobile phones, hardware and stationery items, have been allowed to open. However, those located in marketplaces, malls and COVID-19 hotspots and containment zones will continue to remain shut. These shops are to have only 50% of the workforce and it is mandatory to wear masks and follow social distancing norms. Meanwhile, restaurants, salons and barber shops remain closed as they render services and the relaxations only pertain to shops selling items. Delhi Chief Minister Arvind Kejriwal today said Centre's decision to open certain shops will be implemented in the national capital too. However, no relief will be granted to COVID-19 containment zones. Gujarat government has also allowed standalone shops to operate across the state from today, except in areas declared cluster containment zones by local authorities. Some states, including Assam, have yet to take a call on Home Ministry's order. With Anand Chaturvedi, Suparna Sekya, AIR News, Delhi.
Over 684 tons of essential and medical supplies have been delivered across the country under Lifeline Udan during COVID-19 lockdown. Lifeline Udan flights are being operated by Civil Aviation Ministry to transport essential medical cargo to remote parts of the country to support India's war against COVID-19. 383 flights have been operated under Lifeline Udan by Air India, Alliance Air, Indian Air Force and private carriers. 223 of these flights have been operated by Air India and Alliance Air. The aerial distance covered by Lifeline Udan flights till date is over 376,000 kilometers.
Keeping the spirit of oneness and charity alive in the holy month of Ramzan amid COVID-19, a group of 12 girls have come together in the Doda district of Jammu and Kashmir to stitch masks for free distribution. The fasting girls are voluntarily stitching the masks to hand over them to the district administration for free distribution among the needy. The girls have stitched 1,100 face masks so far and plan to hand over the first installment of 5,000 masks to the administration by Wednesday. The holy month of Ramzan commenced yesterday, and the residents of the Kashmir Valley are preferring to stay indoors and not to make any religious congregations in the wake of the unprecedented outbreak of coronavirus pandemic. More from our Srinagar correspondent.
Lieutenant Governor G.C. Murmu has congratulated the people of Jammu and Kashmir on the commencement of holy month of Ramzan. He has hoped that the auspicious period would be a harbinger of peace, amity, brotherhood and prosperity in Jammu and Kashmir. He has said that holy month is a period of fasting and prayers which are imperative in putting an end to the sufferings of the people in the wake of coronavirus pandemic. Meanwhile, people in Kashmir at large have been strictly implementing the social distancing norms and making fervent prayers to Almighty God that the prevailing uncertainty and hardships all around may end at an early date. This is Sunil Kohl for AR News from Srinagar.
Uttar Pradesh Chief Minister Yogi Adityanath has instructed for strict compliance of lockdown in the state. He has said that no public function will be allowed to organize in the state till 30th of June. Mr. Adityanath was reviewing a meeting on lockdown in the state at his official residence in Lucknow today. The Chief Minister said that the doctors and paramedics must be safe from infection at any cost. He said that PPE and N95 masks must be ensured for medical staff. A report.
The PPE kits and masks prepared at this center are made available to the corona warriors. As of now, more than 80,000 masks and more than 4,000 PPE kits have been prepared. The guidelines of lockdown and social distancing are being strictly followed at center, and workers are called shift-wise to minimize the gathering. Principal Director of this center, Sunil Gupta, told that MSME centers across the nation are supporting in this fight against COVID-19 by preparing various needed items in this moment of crisis.
हमारे पास सिलाई की 110-20 मशीनें हैं जिससे हम मास्क बना सकते हैं, ओवरऑल बना सकते हैं और इसी का बीड़ा उठा के करीब 15 दिन से हम मास्क और ओवरऑल का निर्माण कर रहे हैं, पीपीई किट का निर्माण कर रहे हैं। अब तक हम 80,000 मास्क बना चुके हैं और करीब 4,000 पीपीई किट हमने बना के मार्केट में दी है।
These MSME centers, besides manufacturing of essential items, are also providing employment to hundreds of youths in this time of crisis. With Sangeeta Srivastav in Mirror, this is MS Yadav, AIR News, Lucknow.
In Rajasthan, the number of COVID-19 infected persons has gone up to 2,152, with 69 new persons found positive in the state today. The highest 23 cases were reported from Jodhpur today, while 20 persons tested positive in Nagaur. 11 cases were from Ajmer. Our correspondent reports that the testing facility has been increased to 5,000 samples per day in the state.
Coronavirus patients are having speedy recovery in the state and they are being infection-free. Constable Ramcharan Soran and Deepak Yogi posted at Manak Chowk Police Station in Jaipur have recently been declared infection-free. They were infected during their duty at Corona hotspot Ramganj. Deepak told to AIR,
इस कोरोना से ये सबक लिया है कि इससे डरने की जरूरत नहीं है, सोच पॉजिटिव रखो और अपना आत्मविश्वास बनाए रखो और तथा लोगों से सोशल डिस्टेंसिंग की दूरी बनाए रखो। इसके लिए मैंने योग और एक्सरसाइज की तो मैं जल्दी रिकवर हो गया।
Thousands of doctors and police personnel are working day and night across the country, risking their life to save our lives. So we must stay indoors. Jitendra Dwivedi, AIR News, Jaipur.
In Madhya Pradesh, shops of essential commodities have been opened from today in full compliance with all the protective measures and social distancing. Chief Minister Shivraj Singh Chauhan has informed that a crisis management group has been formed in each district. These groups may decide to open or not to open shops depending on the circumstances of their district.
केवल वो गांव छोड़ के जो कंटेनमेंट एरिया में आते हैं, ग्रामीण क्षेत्र में सभी गांव में दुकानें खोल दी जाएंगी। मोहल्लों में बाजार बड़े नहीं खुलेंगे अभी, लेकिन मॉल, सिनेमा घर, जिम, होटल, रेस्टोरेंट, स्विमिंग पूल, ब्यूटी पार्लर जैसी दुकानें नहीं खुलेंगी।
In Maharashtra, even as the cases of COVID-19 continue to rise, Chief Minister Uddhav Thackeray today said the decision on relaxation of restrictions in the state will be taken after a review of the situation once the national lockdown ends on May the 3rd. At present, 7,628 patients have been affected with COVID-19 in the state, with 323 fatalities. More in this report.
Maharashtra Chief Minister Uddhav Thackeray today said the lockdown has helped in decreasing the pace of multiplication of COVID-19 cases in the state. He said the decision on relaxation of restrictions in the state will be taken after a review of the situation once the lockdown ends on May 3. CM Thackeray told that the decision largely depends upon the situation in Mumbai, Pune, Nasik, Nagpur and Aurangabad, and if the state has to relax its current stringent lockdown measures, it would be in rural and least affected areas of the state. Meanwhile, in a letter written to Prime Minister Narendra Modi, NCP President and former Union Minister Sharad Pawar said the government of Maharashtra requests additional grants of United Nature to the tune of rupees 1 lakh crores for the financial year 2020-21. Kunal Shinde, AIR News, Mumbai.
In Chennai, the Interministerial Central Team made an on-the-spot assessment of the COVID-19 situation by visiting various facilities for the second day today. More from our correspondent.
The 5-member Interministerial Central Team led by Additional Secretary in the National Disaster Management Authority, Dr. Thirupugal, split into 2 groups today and inspected several facilities in Chennai. The first team started with a visit to the State Disaster Management Control Room. Its members inspected the Data Analysis Center established recently at a cost of 50 lakh rupees to compile and analyze all crucial data relating to the pandemic. The team later paid a visit to the wholesale market, a subsidized Amma canteen and a 532-bedded isolation facility established at the ITPO Convention Center in the city. They also inspected the control room for the welfare of the differently abled people and the arrangements in the Chennai port. Meanwhile, the second group inspected various medical facilities in Chennai and reviewed the treatment there. The city carries the maximum number of patients and the new cases are also consistently higher than in other places in the state. Jai Singh, AIR News, Chennai.
Robots are also part of Kerala's COVID-19 fight now. The state is using robots to minimize the human interaction in the COVID-19 treatment. A report.
The robot named Nightingale 19 is being used to provide food and medicines to the COVID patients at the District COVID Center in Anjanakandi in Kannur district in Kerala. The robot also has a special display facility attached to it that allows patients to communicate with health workers and their relatives. Nightingale 19 was designed by a group of engineering students with the support of the State Health Department. On similar lines, a robot named Karmi Bot is being used to assist patients at the COVID-19 isolation ward in Ernakulam Government Medical College. Karmi Bot serves food and medicines to COVID-19 patients, collects trash, performs disinfection and enables video call between the doctor and the patients. The robot is developed by Asimo Robotics, a company working under Kerala Startup Mission. These robots reduce the interaction between the COVID-19 patients and the health workers, and it addresses the shortage of PPE kits by minimizing its use. Mayusha for AR News from Thiruvananthapuram.
In our series Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Talking to All India Radio News, Dr. Amar Chand Bajaj, Senior Consultant in Sitaram Bhartiya Institute of Science and Research, New Delhi, highlighted the need of social distancing to defeat novel coronavirus.
Don't try to leave your home. The what is the lockdown that you should keep yourself under lock in your house. Before stepping out of your home, always think that is it really needed. The other thing is like you need to go buy for your daily needs things like grocery, milk or vegetables. You will need to go outside for that. So even if you need to go outside for all those, you will have to remember that try to keep as much as distance in between the two persons you're standing in the queue or wherever you are there outside your house.
High Commissioner of India to Bangladesh, Riva Ganguly Das, today handed over emergency medical supplies consisting of 1 lakh hydroxychloroquine tablets and 50,000 sterile surgical gloves to Bangladesh. Announcing this today, the High Commission of India said the second tranche of assistance came from the COVID-19 Emergency Fund, which was created at the initiative of Prime Minister Narendra Modi during his 15 March video conferencing with the leaders of the SAARC countries. And now, before we end, the headlines once again. Prime Minister Narendra Modi says India's fight against COVID-19 is people-driven. In his Mann Ki Baat, Prime Minister says centre and state governments working hand in hand to provide relief to the needy. Mr. Modi urges people to follow Ayush Ministry's corona-related protocol to boost immunity. RSS Chief Mohan Bhagwat appeals to Swayam Sevaks to work proactively and help all those affected due to COVID-19 pandemic. Standalone and neighborhood shops open in non-hotspot zones in many states. Over 684 tons of essentials and medical supplies delivered by Lifeline Udan during lockdown. India hands over emergency medical supplies including hydroxychloroquine tablets and sterile surgical gloves to Bangladesh. And with that, we end the special news program on COVID-19.